Dr. Arvinder Soin, explain politics aside, the situation in your hospital, explain what you're hearing, and most importantly, I'm concerned only about patients, I'm concerned about the relatives. We are getting frantic calls from people saying, kuch kara do, bharti kara do, oxygen supply nahi hai, my relative is dying, we are struggling from one hospital to another. How should people who are listening to you at this time be dealing with this unprecedented crisis?
Rahul, unfortunately, I have to say that the situation is very grim. The hospitals are generally inundated with crowds of both non-COVID patients and COVID patients who need admission. However, I agree with Mr. Chadda that there may be other hospitals apart from the mainstream 6 or 7 hospitals which may have beds. So people shouldn't only look at major big hospitals when they need COVID care. They should go through the lists that are widely available on websites and online and actually rush to help wherever it is available, not just big hospitals. That's one. The second thing that needs to be done is that you shouldn't panic as soon as you test positive. If you're asymptomatic or mildly symptomatic, you should please stay at home. This is my request to everyone. Because what that's going to do is it's going to set you in a state of panic. It's going to get your doctors in a state of panic. You're going to crowd up hospitals. You don't need to be there. There are clear defined criteria of what you need to do when you're at home. You should opt for remote care, online care. And then only if the fever is not subsiding beyond 7 days, if you're breathless, if the oxygenation is less than 94 continuously, it's only then that you need to get to hospital. So please do not crowd hospitals and please let patients who have severe COVID be cared for so that we can save their lives. The other thing is that all of us, the healthcare workers, have really risen to the occasion, not just in my hospital, every hospital, because most of us are vaccinated. We are emboldened and we are out there trying to save as many people as we can. But we need responsible behavior from everyone. No crowds at all at any cost. And everyone must do the social vaccine, which is often repeated, which everybody knows.